Mr. Lance from New Jersey for 5 minutes for questions. Mr. Lance lost interest. Mr. Griffith, 5 minutes for questions, please.
Thank you very much. I appreciate our committee working hard on this. As you have heard, we can always make things better. And one of the things that the American people want, and my people that I represent in Virginia and my district want, is folks to make sure that if they need the help, they get it. But if they suddenly find themselves millionaires because they've won the lottery or they've gotten some other lump sum payment, they don't think those folks ought to necessarily be getting Medicaid. And so while I have heard it said that, you know, throwing it around that millionaires are getting Medicaid is a bad rub, currently it's a bad rub the average hardworking American taxpayer is paying for. Wouldn't you agree, Dr. Roy?
My foundation, the Foundation for Research on Equal Opportunity, is dedicated to expanding economic opportunity for those who least have it. Generally speaking, millionaires and billionaires are not people who at least have economic opportunity in this country. And
in fact, when I read the bill, I noticed with some interest that I thought it was fairly generous because it basically allocates it out as roughly $40,000 a month for the first, say, $100,000, and then it's more than that. So it's not like we're saying that if you win $1 million, you can never be on Medicaid again. It's fairly loose, wouldn't you agree?
I mean, to me, it's very simple. If you can afford to buy health insurance yourself, please do so. If you can't afford health insurance on your own and you need the financial assistance and are eligible for the financial assistance that Medicaid provides, then let's find a way to get you that assistance. It seems completely non-controversial, and I really don't understand why members of the minority find this problematic.
And I'm going to switch gears, but stick with you, Dr. Roy, if I might. In your written testimony, and I don't believe you've had an opportunity, and I apologize if I missed it somewhere, but I don't believe you've had an opportunity to discuss it. On page 8 of your written testimony, you start getting into issues about how, and I'm going to quote, the interests of state and federal governments have diverged in Medicaid because of the way it's set up. And I'm not sure these bills directly get to that, but I thought that was interesting testimony because it's one of the things that has been a bad rub for Virginia, in that you then go on to talk about how the federal government has done some things that maybe they ought not to have done, and the state governments have responded and have done some things where they came up with creative financing, and you actually reference Medicaid hospital taxes. And in Virginia, we rejected that concept because we saw it as a tax on the sick, and that they wanted to create a bed tax where, if you were a Medicaid patient, you would get the money back as increased costs, and you would receive, as you said in your testimony, whatever your match was. In Virginia, it's 50%, but you use 60% in your example. You would get that money back, and so the states have actually gamed the system in some states to get more federal dollars for Medicaid, and in some cases like New York, they've actually had to have reforms because they gamed it so much, they had so much money floating around, they were wasting millions of dollars. Isn't that true?
Absolutely, and a number of the states, in fact, nearly, I would say a majority of the states that have expanded Medicaid under the ACA, in theory,
hang on just a second, Mr. Chairman, I'm having a hard time hearing.
The gentleman is correct, and time will suspend. The chair notices a significant difficulty hearing the testimony of the witness, even with amplification. So can I ask conversations be taken off the dais in respect to our witnesses who've been with, or agreed to be with us this morning?
Thank you.
Well, the gentleman continues to suspend. We'll take conversations off the dais to allow the witnesses a chance to be heard. Chair thanks the committee. The gentleman may proceed.
A majority of the states that have expanded Medicaid under the ACA have used provider taxes and health insurance premium taxes to fund the theoretical 10% match that they're supposed to contribute. We've heard some descriptions of the so-called savings that states have achieved by expanding Medicaid. There are no so-called savings. What's happened is that state governments have raised taxes on Medicaid providers and on Medicaid managed care companies and used those revenues to fund the Medicaid expansion in their states. In other words, increasing the federal liabilities for the Medicaid programs in ways that the ACA did not contemplate. That's not just true of the ACA. In my written testimony, I cite the fact that on average, the FMAP, the match rate at the federal level, is around 58 to 60%. At least that's what it is supposed to be on paper. In reality, it's closer to 70% because of these taxes that states use to game the system and raise costs in the Medicaid program and drive revenue to the states from the federal government that they otherwise wouldn't gather and aren't supposed to obtain.
And I'm going to summarize and probably then have to conclude, but in summary, if the federal government gives the state $2 million and the state was only going to spend $1 million, the state has not saved $1 million. The federal government spent $1 million that maybe it didn't need to. Well, I support all three of these bills, but I would invite all of our witnesses, if you have ideas on ways that we can improve these bills, please let us know, because we are trying to make sure. I agree with the philosophy, but if there's some way that we can make the bills better, please let us know, and I would appreciate it very much if you'll get that in writing. That'd be great. And with that, Mr. Chairman, I yield back.